Me, Angela from the Inspiration Edit, and today I want to share with you all about the adrenal pump. Now, if you are a follower of my blog, you will know and have heard about me talking about the adrenal pump. It's a medication that I have which keeps me alive. Without it, I would be dead. And I need this medicine all the time. Now, what I'm going to do is I'm going to show you why I need it, how it works, and give you a good demonstration so that anyone that wants to know how it works will get a good idea. So we'll start with my little drawing, which is a cortisol day curve. Now, I don't make cortisol, my adrenal glands don't make it. That's why I have adrenal insufficiency. In a normal body, around 2 AM the body would start producing cortisol, and by the morning you would have a lot in your body, which would give you everything you need to get up and go in the morning and to get through the day. And then as the evening starts, your cortisol levels will drop again through the night, and then they'll start again in the morning. And that's pretty much what happens in a normal healthy person. If you don't have cortisol in your body, you will die. So for anyone with adrenal insufficiency, you need cortisol replacement. And the medication which most people get is hydrocortisone tablets. Now, for me, hydrocortisone tablets didn't work very well. It made me very ill. I was always in a wheelchair. I was always in and out of hospital. And there's a few reasons for that. Firstly, I don't absorb tablets very well. Okay, so the main medicine that you get for adrenal insufficiency is hydrocortisone tablets. Now, I was on hydrocortisone tablets, but that made me very ill. I was always in a wheelchair, always in and out of hospital, having adrenal crisis. And as my endo said, I was pretty much on death's door. What I did is, and I will show you now on this little piece of paper. So I would wake up at around 6 or 7 in the morning and take a tablet. Now that tablet would take 2 hours to absorb and work. So my cortisol levels would shoot up by about 8 AM. Now, in the meantime, when I woke up, my blood pressure would be so low that I wouldn't be able to stand up, and I'd be dizzy and sick. And if I tried to stand up, I would collapse. I would feel sick, I was in pain, achy, sore, and then just as it goes in, it drops back out of your system, because after 6 hours, the medicine drops out. So then you take another tablet, and it goes up again. Now, you do it again in the evening, and it goes up again and starts to come down again. So pretty much, instead of having the natural curve that a healthy body needs, someone with adrenal insufficiency on tablets would be like having medicine. It takes 2 hours to absorb, then it drops out, in, out, and that would cause many symptoms that just make you sick all the time. Now, the solution for this is to find something which will give you the medicine you need according to the natural day curve. And I have, in my sniggle case, my adrenal pump, which I've just taken off just before I had a shower. And this pump allows the body to receive cortisol according to the curve, which makes my body much more healthier than taking tablets that drop in and out of the system all the time. So this is the adrenal pump. It's actually a Medtronic pump, and it's for insulin for diabetics. But you can, instead of putting insulin in, put in cortisol, which is what I do. Now, this is not readily available in any countries, let alone on the NHS. They don't really want to know at the moment. I know of 2 people that do have the adrenal pump on the NHS, but I had to go private. I had to save up a lot of money and get some support to it's around £3,000, and then on top of that you need your monthly costs. I'm going to show you how it works. So, okay, so I'm going to show you how to prepare medication. So first of all, we've got 2 containers of Solu cortef, which is my cortisol medicine. We have some water, 1 needle, and a reservoir. So what we do is we've got 100 milligrams of Solu cortef in each of these containers. Now what I need to do is put into these 100 milligrams, and this is water to mix in here to make the solution ready. So I'm going to open it, which I've done, get my needle, and I need to collect the water that I need to put into the medicine. So that's the easy part. Takes a bit of training. And you just draw it out like that. Takes a bit of time. And I'm going to be drawing out 100 units on this needle and putting 100 into each of my Solu cortef vials. So get in there. Now, one thing you don't want to do is have any bubbles. And I've got bubbles, you always get 1 or 2, so I have to hit it and get the bubble to go to stop. Did you see that? Da-da. So, got my 100 units. I'm going to pop that into here. I'm going to put that in here. Ooh. And squirt in water. Now, that should mix up pretty good. I'm going to repeat the process again. So I'm going to get my water. Now what it does is you mix up this water with the powder, and that creates the medicine, which will go directly into my bloodstream, and it will give me my medicine immediately. Unlike the tablets where I have to wait an hour for it to start working and then it stays in the system and then drops out, this goes straight into the bloodstream. Now it's getting a bit tricky. That's got a huge massive bubble, so I'm going to have to redo it and start again, which sometimes happens. So what happens is, once I've got these 2 vials, I'll have, if you can see, this one's just powder. Can you see the powder in there? And this one is now dissolved into a liquid, which is just exactly what I need. Now if I was going into an adrenal crisis, which does happen, me or someone else would have to make this up and then inject that directly into my muscle, which is a bit ridiculous because when you're... This is not working. Now I'm going to fill the second tube. Now another 100 units to go into the Hydrocortisone Solu cortef vials. It's slowly coming up. And yeah, before you do anything you do have to wash your hands, which I did do, because you don't want to get no germs anywhere. Now if you look, this vial has got powder in the bottom, whereas this vial, which I've just added water to, is now a nice liquid of Solu cortef. So I'll be putting this into the second one, squirting it in and letting it mix. Now, if I was about to go into an adrenal crisis, or if I was heading towards that stage, I would need an emergency injection. Now, there is no EpiPen, like someone who has an allergy. What you would have to do is you'd have to draw up the medicine, pop it in here, draw it back out, and then inject it into your muscles to stop you having an adrenal crisis or to prevent it, and then you'd have to go to the hospital. Now for me, having this medicine in a pump, I can just automatically give myself extra medicine straight into my bloodstream, which means that I can kind of do it on my own rather than relying on someone else to come and inject me if I'm too ill. I can just hit the extra button and just give myself extra medicine, and it actually has stopped me going into hospital many times, so it really does work. Now we have got here a reservoir, and this is the magical part. A reservoir will go into the pump and it will slowly, by the mechanics, release the right amounts into my bloodstream. So I've now got 2 solutions, and I will put that into there, and I just pull this down. Can you see that? I'm collecting the water from here, the Solu cortef, into the vial. So that's the first one done. And the second one, I will collect more and do it right down to 1.8 mils. So that's as far as it can go. So I'm nearly there. You can see that 1.8. Right, so there you go. Oh! So we now have a vial. Now you have to be careful, because if you pull it out, all the medicine will get wasted. You actually have to twist it. Like that. Ta-da! And you then disconnect this section, and this is what you're left with. A little Medtronic reservoir. Now to buy reservoirs, it's around £29 for 10 of them, which I have to pay for myself, and that will fit into my pump in here. And next part is the connection, and that's even tricky. I'll show you how that works next. Okay, so what I've got here is a Medtronic giving set. Now these cost me around £10 for one. I have to fund them all myself, so, and it lasts up to 3 days, so that's going to cost me £10 every 3 days for this. And what I'm going to do is show you how it works. First of all, I have to create a needle site in my stomach. So I'm going to put this needle into my stomach, so this is going to be the point of entry for the cortisol. So yes, this is my tummy. It's a little bit scarred, and I last had my last needle here, so I think I'm going to have to put one on this side today. So I am going to start off with giving my tummy a little wipe. Just make sure it's clean, and then I'm going to put the needle in. I don't like doing this, it's not fun, and sometimes it doesn't hurt, but sometimes it does hurt, and I think it depends. So this is how it happens. Can you see that? Today I'm going to stick that needle into my stomach. Come on. Ah. Come on. Right, it's going in. 1, 2, 3. Nearly there. It's nearly all the way into my tummy. So once it's needles in, I can stick the plaster bit. I'll pull that out. And there you go. I have got one needle set on my tummy, which is all ready to go. And for now, I'm going to pop this in here to keep it clean. That's where the medicine will go in, right here. Okay, so now we're doing the next part, which is the giving set. Now this giving set is going to connect to the pump and to my stomach. Now I don't need to show you my stomach all the time, Not like anyone would want to see it. But pretty much, you connect the Solu cortef. Yeah. So it's got a little needle there, and it connects in like that, and clips. What I'll do is, and then pop that into the pump, twist it round, and it's beeped. That's what it does. So now I'll show you how that works. We've got to, it's rewound. Are you disconnected? Yes. Fill tubing and hold. So what I'll do is, I then take this section off here and fill the tubing. Now we will know it's filled when a little bit of liquid comes out the top. It's making this tiny little noise. Oh, do you see the water at the top? Yeah, it just dripped off, which means it's ready. So the next part is to connect it to my stomach. So I'll do that. So I can take that off now and connect it here to my tummy. And it says, fill tubing, escape when done. Done. So it's going to ask me now, do you see the drops of the tubing? Yes, I do. Connect to the body, which I've just done, and fill. It's going to fill from here through to that part there. So, fill. It fills 0.7 units. So it's starting to fill up this section here, which takes about 20-30 seconds, a bit longer. I'm at 0.3, so I'm halfway through, and then that's done. 0.5, 0.6, 0.7, and that should beep when it's done. Beep. Yep. And we are all ready to go. Now I'm on my right rate. I've got a pattern which is 20 units per day, and it's set so it will go according to my day curve, which we spent days working that out with the doctor in London, and we're all ready to go. So that is how it works. This is how my adrenal pump works. Now what is really great about having this is that, as I said, it will deliver medicine now into my stomach for the next 24 hours. So you don't usually take this off ever, except when I have a bath. So I just had one and quickly put this back on. This is the adrenal pump. What's really good about it is it goes according to the day curve that I need, which we worked out with the doctor in London. Yes, I will need to get tests every 6 months to make sure I'm getting the right levels and the right rates. Now with cortisol, if you have a sudden shock or sudden surprise, you have illness, fever, go on an aeroplane, all sorts of different reasons, you'll need to double up. So you just change the rates from a single rate to a double rate, and it'll automatically give me double medicine. If I have a sudden crisis episode and I start heading towards adrenal crisis, I will hit the bolus button and I'll give myself extra medicine, see how I feel. If I need more, I'll give myself more again. Now, back in the days before I got this pump, I would have to make up 100 mils, inject into my muscles, go off to the hospital. But I've been on this pump for a year and I've not had to go to the hospital once for adrenal insufficiency, compared to nearly 22 times in the past. I think that's amazing. And I know I still get sick, I still get ill. Right, so what I love about this pump is how it has changed my life. And pretty much I would wake up in the morning unable to stand up. I'd have to take medicine and wait for it to work. And then I'd be able to stand up by lunchtime. But then, because I've been waiting all day, my muscles were sore and achy and I was just sick all the time. I still get sick regular, but it's not in the way that it was. If I do have extra illness, which happens every week, like an infection or extra stress or something goes on, I have to increase my medicine, which I will do. I can give myself a bolus and extras, and I can ride the wave and get through. Before, I would end up in hospital. Now I'm not in hospital, and it's just better because if I'm sick I can go lay in bed and within a day or so I'm feeling better than I was, rather than spending 10 days in hospital sick as a dog. The thing that really does bother me is that I can't get this on the NHS. I can't get it yet. But that could change in the future. At one point the diabetes pump wasn't available, but now it's available to many people, and hopefully this adrenal pump will one day be available to many people with adrenal insufficiency. I know this is a rare condition, so there's not as much research and work being done, but there are people out there working on it, and there's not many in the UK, but there are a select few trying hard to do research and show that this is a good option for dealing with the illness. And economically it's just saves so much money, because the tablets I was on were £80 a month. To have this medicine and the giving set and the reservoir and to run it monthly costs about £150. So it's about £60 more to be on a pump per month than it is to be on the tablets. However, when I was on tablets, I would be going to the doctors more and using NHS money. I would be ringing up ambulances more. I would be having more blood tests. I would be having more cortisol tests. I would be in hospital, spending days in hospital. I would be in the A&E, using up precious time, using all the resources, having blood tests done. And when you go in hospital with adrenal insufficiency, you often have to go in an isolated room, and you also have to be tested to find out what's caused your body to be in stress. So you might have to go have x-rays, you'll have to have blood tests, and the costs are in the hundreds and hundreds of thousands. So having this pump, which is £3,000, which I paid for outright, is just like a drop in the ocean compared to the cost of not having it. I think this is the way forward for people with adrenal insufficiency, and I really hope and pray that one day this will be available to people throughout the world that need this, because I really know firsthand that it works. It might not be right for everyone, and it's not nice putting a needle in your tummy and trying to manage it, but it's much better than being in hospital and being unstable, and it gives me the chance to stay home and be a mother, which is what I want to do. That's my goal, to be able to do as much as I can for my daughter. So this is the adrenal pump, and this is a second-hand one, so I'm starting to save the money for a new pump before this one kapots and runs out. So we'll see what happens. I've given myself 6 months to try and save up, so let's see what happens. Hope you enjoyed this video, and I hope it helps you to understand more about the adrenal pump, what it does, how it works, and how it can benefit people, hopefully in the future. See ya!